everyone. Today I am going to tell you about one of the family planning method, that is copper T. So this copper bearing intrauterine device. So this copper T is one of the type of intrauterine device which is inserted in the women's uterus or called as women's womb. So it stays inside there and prevent from pregnancy for some period of time till when the couple wanted to have a gap between the two baby. Okay. So this copper bearing intrauterine device, what is this? The copper bearing intrauterine device, or in short form it's called IUD. Okay, it's a small flexible plastic frame. Okay, with copper sleeve or wire. It contains a copper sleeve or a wire around it. Specifically trained health care provider insert it. When it is inserted and who has to insert? Especially well-trained healthcare provider will get inserted, either by the obstetrician or either by the specialized nurse in obstetric and gynae, well-experienced person. So almost there are many types, but almost all type of IUD, intrauterine device, have one or two string. It has or thread, string or thread, which is tied, okay, to them, and the string hang through the cervix into the vagina. So it works by causing a chemical change that damages sperm and egg before they can meet. So it is one of the barrier which is protecting the sperm and the egg to meet together. So that's how it prevents from fertilization and then protected from pregnancy. So how effective this copper T is? So one of the most effective and the long-lasting method here, less than one pregnancy per 100 women using in IUD over the first year. 6 per 1000 women who use the IUD perfectly and 8 per 1000 women as commonly used. So this means that around 992 to 994 of every 1000 women using IUD will not become pregnant. A small risk of pregnancy remains still beyond the first year of use and continues as long as the woman is using IUD. So over 10 years of IUD use, about 2 pregnancy per 100 women. So this is the ratio around how much it can be prevented or protected from pregnancy. So there are some side effects. If we say about side effect, some user report that changes in the bleeding pattern, okay, especially in the 3 to 6 months, including prolonged or heavy monthly bleeding, irregular bleeding might occur, and more cramp and pain during the monthly bleeding. Okay, then non-health benefit, if we say, helps protect against risks of pregnancy. This is only the one, and may help protect against cancer of the lining of the uterus. That is called as endometrium, the lining of the uterus, the uppermost. Cervical cancer, reducing the risks and risks of ectopic pregnancy also is the benefit. Then the non-health risks. What are the risk factors? Which is uncommon, may contribute to anemia sometimes if a woman already has low iron blood stores before inserting the IUD, causes heavier monthly bleeding. So because of that might cause anemia. Then rarely pelvic inflammatory disease might occur, inflammation in the pelvic region, and may occur if the woman has chlamydia or gonorrhea, which is sexually transmitted disease, at the time of IUD insertion. Okay, this is the risk. And if you say complication, puncturing or performing of the wall of the uterus by the IUD or an instrument used for insertion, usually healed without a treatment. So miscarriage or preterm birth or infection, in the rare case that the women become pregnant with the IUD in place. It's very about this one, intrauterine device. So it can be used by women of any age, including adolescent. Okay, this can be used and can be used by women who have had children and those who have not. So mostly we prefer those who have already have children. Then the second prevention it can be used. Otherwise, for those who are non-parents women can be used for the other technique also because of some side effect. Okay, so do not increase the risk of contracting like STD or including HIV. Do not make women infertile. It doesn't make the women infertile. After removing the intrauterine device, again the women can become pregnant. Do not cause any birth defect because of this, and also do not move too hard or brain. Okay, do not cause discomfort or pain for a woman or the man during the intercourse, and substantially reduce the risk of ectopic pregnancy also. Okay, so these are the summarization of IUD, a short explanation about intrauterine device. So there are many types of again intrauterine device. If we explain, there are generation wise, first, second, third generation, it goes on. So for further more detail, keep watching my video. I'll explain in